Hello, and thank you for letting me be part of your Health Awareness Week. Today we're going to be talking about sexually transmitted infections. I know this may not be the most exciting or most comfortable topic to talk about, but it is really important. Everyone in this room is the future, so keeping you informed and educated about your health is very important. So sexually transmitted infections are often called STIs, and they're infections that can be passed through sexual contact. Now, you'll hear me say this throughout the presentation. That does not mean sex alone. It can be different forms of sexual contact, too. It's passed through body fluids, blood, or the mouth. Anyone partaking in sexual contact can get an STI. Today, we're going to be talking about the top 3 STIs that impact teenage males in Minnesota, since that's what applies to you most. However, there are over 20 different types of STIs that exist. When you walk out of here today, I want you to know what STIs are, how they occur, how to protect yourself, and when to seek care. Whether this is a concern for you now or down the road, I want you to have the power and education to know how to keep yourself safe. So pop quiz, how many STIs were reported in the state of Minnesota last year? I don't expect you to know this, but I did want to share it because I think it's an interesting finding. So the actual number is 31,105. And it's important to note that the real number is likely much higher because some people do not report it to the state. And there's also only certain ones that have to be reported to the state, not all of them. So it is a big issue in our area. So we'll be talking about 3 different STIs today. And those are gonorrhea, chlamydia, and syphilis. So starting with gonorrhea, it is a bacteria that enters the body through sexual contact. Again, does not have to be sex. It can be forms of sexual contact, either vaginal, anal, or oral. If you were to get gonorrhea, typically men will have thick, pus-like discharge from the penis. They can have rashes in different areas of the body, and they can have aches or pains, kind of body aches. Another interesting part is some people who have gonorrhea have no symptoms at all. So if a partner tells you that they tested positive, it's important to trust that and be safe to get tested, regardless, even though you feel fine. So how do we test for gonorrhea? A urine sample can be done to look for it, or they can do a swab that's inserted into the opening of the penis to collect discharge and test it for different infections. The good news is gonorrhea is very treatable because it is a bacteria. Antibiotics can be used. Typically for this one, they do a combination of an injection and then an antibiotic you take by mouth. The injection is one typically done in the kind of hip or butt type area. And it is important that partners need to be treated too. So encourage your partners to seek treatment if you have tested positive. And it is very important to not have sexual contact again until all partners have completed treatment. Not started treatment, completed it. Otherwise, you can continue to pass this back and forth or spread it to others. Gonorrhea is one of the STIs that's required to be reported to the state. What I want you to know is this is a confidential process. People worry about this getting out there. The information is kept strictly confidential, and it's used so state officials know what STIs are most common, what trends they're seeing, and how we can best serve the community and keep them safe. The Minnesota Department of Health can also assist with partner notification. So if you're uncomfortable going to previous partners and telling them about the infection, they will help with this, and they do it anonymously. So they won't give your name, but they'll call and let previous partners know, hey, you've had an exposure to gonorrhea, we recommend testing. So like most STIs, gonorrhea is only completely preventable through not having sexual contact at all. That's not always the most practical method, but it is the only one that's 100% effective. There are other steps you can use to decrease the risk, such as using condoms, confirming with partners if they've had STI testing, completing STI screenings yourself, limiting your number of sexual partners, and again, avoiding sexual contact until all partners have completed treatment if there's a potential for exposure. Chlamydia is another STI that's quite common. Again, it's a bacteria that enters the body through sexual contact, vaginal, oral, or anal. Chlamydia, actually, the infection enters inside to the body's cells and then releases the infection. This one will typically cause discharge from the penis, and it can be quite uncomfortable. So a lot of pain or itching when urinating. There tends to be a lot of redness or pain at the opening of the penis, which a lot of times that would cause people to want to go into their provider to know what's going on. It's quite uncomfortable. Sometimes people do not have symptoms at all. It's tested the same way as we test for gonorrhea, so through either a urine sample or a swab. Something interesting to note, if you have STI screening done, typically they can test for gonorrhea and chlamydia together. So if you go in with a concern through just one urine sample or one swab, they can typically look for both things at once. Chlamydia is also treatable because it's a bacteria. We can use antibiotics, and there are a few different options. One is an antibiotic used twice a day for 7 days, and then another is a bigger 1-gram antibiotic tablet you take one time and then you're done. We want to make sure people are fully completing their course of treatment so they're fully improved and so they do not spread it to others. The one-time dose is a nice option because if we're worried like someone might not complete the whole course, the one-time dose helps to increase the chances that they will. Again, with chlamydia, we want to make sure that you're updating partners or using the state program to assist with partner notification. Do not have sexual contact, again, until all partners have completed treatment. And this is, again, reported to the state confidentially. So how can you prevent chlamydia? The same way as we talked with gonorrhea. So the only 100% effective method is avoiding sexual contact, but using condoms, STI testing for you and your partner, limiting the number of sexual partners, and abstaining from sex until STI treatment is completed are all ways that can help. The final one we'll talk about today is syphilis, and this one's a bit more complex than the other ones. So with gonorrhea or chlamydia, if you get them, typically you'll start having symptoms within a week. With syphilis, it can be much longer. You might not have any symptoms for 3 to 6 months after you were exposed, which can be difficult to even think back to that point, who the partner was, where it could have came from. Syphilis can be a bit harder to treat, and it can progress in stages, and it kind of increases as we go. They get more dangerous. So you hope to find this as soon as you can. So this first stage usually starts with a sore somewhere on the body. It will look like an ulcer, but it's usually not painful. It can be on the mouth. It can be by the anus, on the penis, in different areas. So if you have a lesion like this, good idea to get checked by a provider. If it goes beyond that point without treatment, then it can show up as the second stage, and that's more like flu-like symptoms. So sore throat, fever, loss of appetite. You can have a rash on your palms or on your feet. This again, too, if you think about illness season, like pink eye, influenza, hand, foot, mouth, a lot of these symptoms are similar. So depending when they pop up, people might not put together that this was syphilis from an exposure months to a year ago. And then finally, the last stage is really severe. We hope to catch it before this point because patients can develop heart problems, nervous system problems, severe ulcers or sores, damage to their vision or eyes, and even death if it progresses any further. We test for syphilis with a simple lab draw, and it can be treated with penicillin when it is detected. However, it depends how far this has gone before we find it. So if you have progressed to one of the later stages, you may need wound care for ulcers, or you might need to see a heart specialist or an eye specialist, depending on the damage that's happened to your body. Syphilis is confidentially reported to the state by providers, and they do help with partner notification. With this one, because it has such severe symptoms, a lot of times the state does follow up with you. And prevention, using condoms, limiting sexual partners. If someone tells you you've been exposed, get testing as soon as possible before this progresses. And then making sure you're abstaining from sexual contact until a provider tells you that it's safe. STI testing is more common than we think. About 1 in every 4 male high school students will have an STI before graduation. So it's important that we're limiting the number of sexual partners we have and having open conversations about STI screening and testing. Although STIs can be scary or uncomfortable, it is important that you have an open relationship with your healthcare provider and talk to them about screening or any concerns that you have. Their number one priority is keeping you safe and healthy, not judging you. There's also strict confidentiality with STI testing, and the Minnesota law allows teens to get STI testing and treatment without consent to their parents. Here's a list of local resources that you can go to for STI testing or sexual health. And please follow up with me if you have any other questions or concerns.